What about spirometry? This is the spirometry we obtained in COPDGene. I'm going to use it to remind you of what COPD is by spirometry. The bottom on the x-axis is FEV1 as a percent predicted. And the black line there to the right is normal FEV1, which is greater than 80% predicted. To the left of that black line at 80%, that's abnormal low FEV1. But really what defines COPD is not the FEV1 alone, it's the FE1-FVC ratio on the y-axis. And you can see a line there at 0.7. So below 0.7, an FEV1-FVC ratio below 0.7 means you have airflow limitation and may have COPD in the right clinical setting. If your FEV1-FVC is above 0.7, that spirometry is considered more or less normal. The FEV1 level defines the severity of the airflow limitation. Not necessarily the severity of symptoms, but the severity of the airflow limitation to try to categorize the disease better. You see an interesting group at the top here that I've highlighted in red, and this is we call the PRISM group. That is, they do not have airflow limitation because their FEV1-FVC ratio is above 0.7, but their FEV1 is low. Well, these patients have not previously been said to have COPD, but we found and others that these patients have symptoms. They have shortness of breath. They can't walk as far. They have poor quality of life. They die more. They have more hospitalizations, more ER visits for respiratory problems. So this is an important group, and we don't think they should necessarily be classified as normal. Then you have the truly normal, both a normal FEV1 and a normal FEV1-FVC ratio. So we put together several of the features that we were able to find in our patients with in the COPDGene study, because we had not just a cigarette smoking history on them all, greater than 10 pack years, but we were able to record the symptoms. The level of shortness of breath, the MMRC dyspnea scale greater than 2, just says patients have trouble walking on level ground with a peer. Or chronic bronchitis, which is cough and sputum production. They may have had one, they may have had both. So we add to the cigarette smoking exposure symptoms the patient may have, and then we did CT scans on all the patients in this study. We defined structural abnormalities on CT scan as either emphysema, greater than 5%, because up to 5% can be normal, gas trapping, which means the gas is trapped in one part of the lung and couldn't come out of that part of the lung because the airways were narrow, or airway thickening when you look at the airways visually. And the other thing we had in our study is airflow obstruction by spirometry. And we defined abnormal spirometry as either patients in that PRISM group I talked to you about with a normal FEV1-FVC ratio and a low FEV1, or classic abnormal spirometry. So putting these four features together, we were able to define and delineate different groups of patients that had one or more of these abnormalities.